I'm Jorge Miranda. I'm a vascular surgeon at Baylor Medicine. Diseases like stroke and aneurysms affect the patients in various ways. For stroke, what we discuss specifically in vascular surgery is vessels that are in the neck that feed the brain. When we have a stroke, there's a blockage in one of the vessels in the brain. That area then doesn't get any blood flow. The symptoms that one can experience are difficulty with speech, difficulty moving an extremity, such as the arm or the leg, or difficulty feeling or sensation. Therefore, to that end, what we can do is remove the blockage in the artery in the neck to prevent a further stroke or prevent a stroke completely. For aneurysms, it's a little bit different. This is involving the aorta. In the aorta, there's a ballooning, and then when the ballooning happens in the aorta, there's a risk of rupture. Now, when it ruptures, it has a very high mortality. What we do here at Baylor Medicine is both have minimally invasive options and open repairs to treat those aneurysms and prevent that rupture.